Hey guys, it's Haley, Cosmetology 120 Lab, and today we are going to, we're going to do a lash application, and we are, we are we're going to start out by greeting our client, escorting them to our work area. We're going to look at their current style. We're going to look at or take into consideration their preferences and what they're looking for and what they're looking to gain out of today's service. So we are going to I just drew a total blank. We're going to do a skin assessment. We're looking for inflamed, irritated, broken, raised, swollen skin. We're also looking for wounds or open sores. And we are looking for infection or infestation that could potentially stop us from completing the service safely today. We're also going to talk to the client about their consultation form. So on the consultation form, it discusses any medication or products the client has used within the last 72 hours and any known allergies that the client may have. The second thing it discusses is if the client has had any facial surgeries in the last 3 months, and if they are still under a doctor's care for that. And then then we're going to discuss if they are prone to fever blisters and or cold sores. We're also going to discuss any exfoliants or skin lightening agents they've used within the last 72 hours, as well, and that is your AHAs and BHAs, as well as discussing any facial injections the client has had within the last 3 weeks or 21 days. And that is your Botox and hyaluronic fillers. So if the client is free from all of that, we can go ahead and start today's service. So we are going to begin by washing our hands. So we're going to wet our hands under warm running water. And then we are going to apply antibacterial soap and begin to lather. Alright, so we're going to rinse our hands under warm running water, and then we're going to dry our hands with a disposable paper towel. We're turning off the water with that paper towel, and then we're disposing of that in the trash. Then we are going to use hand sanitizer. And the hand sanitizer does have to be between 62 and 70% ethyl alcohol. And today, the product we're using is 70% alcohol based. start by putting on our gloves. And we're going to get our wipes. So this is a Barbicide wipe. It is EPA registered, effective for use in the salon and spa setting. They are effective as a bactericidal, virucidal, fungicidal agent. And according to manufacturer's instructions, we're going to use 2 wipes today. So wipe number 1 is to clean and sanitize our area. Right, I'm going to clean my chair as well as my cart. And we're going to wipe any of our tops on our little canisters. Wipe down our containers here, etc. And then we're going to dispose of this and allow that to sit for 2 minutes. And then we have wipe number 2, and this is actually disinfecting. So we're disinfecting with wipe number 2, wiping down our cart, wiping down all of our stuff, containers on our cart, disposing of this, and that will sit for 2 minutes. This is going to be my cart top today, and we're going to get all the items that we need. So I have my lashes, I have my lash grip, I have my scissors, I have 2 sets of tweezers, I have mascara wands, I have some makeup remover and a disposable cup. I have my eye rounds, and I have these are actually waxing sticks, but the tip works great for applying the glue to the actual lashes. So that's what we're going to use today. I'm going to open these. Typically these and our mascara wands, these would be in our little disposable cleansers. I mean, not disposable cleansers. They would be in our glass or acrylic containers on our cart. No, I don't have a cart, so that's what we're doing. And then this is my disposable paper that I'm putting over my chair and helping the client onto the bed. And we are applying hairnet to the client's head. We are going to apply our drape, and this just protects the client's clothes. And then we're removing these gloves, and those will go into the trash. And then we are going to wash our hands again. So wetting our hands into warm running water. Lathering with antibacterial soap. we're going to rinse our hands under warm running water. And then we're going to dry our hands with a paper towel. We're going to turn off the water with the paper towel, dispose of that in the trash, and then we are sanitizing our hands again. Alright, so I have my makeup remover here. And I'm gonna let this soak just for a minute. Take disposable mascara wand, and we're just brushing out the client's lashes, making sure that they're clean. And we are going to get out our lashes. We're going to just measure these on the client's eye. Just see that they fit, and these do. If they didn't, we would cut the end off where the lashes are longer, not where they're tapered, so where they're longer on the outside of the eye. We would use our little scissors here. And we would trim that off, dispose of it, and then we would measure again just to make sure that it's right. That looks good, so we're good to go there. I'm going to check this other side. And it looks good as well. So then we are going to begin applying the lashes. There's that. And then we're going to talk to the client about maintenance and aftercare. And then this would be disposed of. And these would go into our to be laundered. And then we are going to clean our space. So we have wipe number 1, cleaning and sanitizing, including our cart, our container, disposing of this in the trash. Then we have wipe number 2. Again, this is disinfectant. Wiping down our cart, wiping down each of our individual containers. Disposing of that in the trash. And we're removing our gloves. And we're going to wash our hands. So wetting our hands under warm running water. Lathering with antibacterial soap. You got these access ones, right? Good. Any fries you don't use, I'm going to eat. Because I didn't get fries. Rinsing our hands under warm running water. Drying our hands with a disposable paper towel. Turning off the water with the paper towel and disposing of the paper towel in the trash. And then we are going to sanitize our hands again. And this one is 70%.